সম্মানিত দর্শক ও শ্রোতা, শিশু স্বাস্থ্য চ্যানেল পক্ষ থেকে ওয়েলকাম। আজ আমি সেপসিস বা কোভিড-19 সম্পর্কে সংক্ষিপ্ত আকারে বলার চেষ্টা করব। সায়েন্স সতত পরিবর্তনশীল। আমাদের যে কোনো তথ্য সতত পরিবর্তনশীল। Sepsis can kill the patient within 12 hours. Sepsis bigger killer than heart attack, lung cancer or breast cancer. Worldwide death in coronavirus sepsis 2.84 million up to 4th April 2021. 11 million people die in sepsis every year worldwide. Sepsis life-threatening organ dysfunction due to dysregulated host response to infection. Quick SOPA score, sepsis-related organ failure assessment. If more than 2 score, mortality 10%. Hypertension, systolic blood pressure less than 100, altered mental status, tachypnea, respiratory rate more than 22. Septic shock, subset of sepsis where underlying circulatory, cellular, metabolic abnormality and profound enough to substantially increase the mortality. Needing vasopressor for mean arterial pressure more than 65 mm mercury and increase the lactate more than 2 millimole per liter despite adequate fluid resuscitation. Sepsis potential life-threatening condition when body's response to infection damages its own tissue. When infection fighting process run on the body, they cause organ damage and finally death. Sepsis in 1 in 3 ICU patients die. So every 3 ICU patient, 1 patient die in sepsis. CRP and procalcitonin early biomarker detection of sepsis. Respiratory rate more than 22, altered mental condition, Glasgow Coma scale less than 13, and systolic blood pressure less than 100 is the early screening for performance of sepsis. Systemic inflammatory reaction, at least 2 of the criteria, body temperature more than 38, heart rate more than 90 per minute, respiratory rate more than 20 per minute, partial pressure of carbon dioxide less than 32, white blood cell more than 12. Sepsis, systemic inflammatory response plus infection, severe sepsis, sepsis associated with organ dysfunction, systemic hypoperfusion and hypotension, and sepsis with arterial hypertension despite adequate fluid replacement. Septic shock when severe sepsis with permanent organ damage, hypotension less than 90 mm mercury, lactate more than 4 mm mercury, and mild, moderate, and severe sepsis. COVID-19 positive patient have mild feature without radiological feature. Moderate patient favor respiratory symptom, radiological feature with severe distress. Dyspnea, respiratory rate more than 30 beats per minute, oxygen saturation less than 93%, and partial oxygen reduced, lung infiltration more than 50% within 24 to 48 hours. So, sepsis can occur viral, bacterial, fungal, parasite, and other trauma, burn, pancreatitis. In COVID-19, interleukin-6 in severe cytokine release syndrome, secondary hemophagocytic lymphohistiocytosis is a type of cytokine storm hyperinflammatory syndrome characterized by permanent fatal hyperkinetic multi-organ failure. Pathogenesis involved defective granules-mediated cytotoxicity, uncontrolled T-cell activation leading to exaggerated inflammatory response. Fever, chill, very low body temperature, fast hot breath, nausea, vomiting, diarrhea, fatigue, and blotchy, discolored skin. And risk factor for sepsis in a patient: malignancy, asplenia, stem cell transplant, indwelling catheter, central line, solid organ transplant, immunosuppressive medication, severe neurological disability, other immune deficiency. High sequential organ failure assessment: D-dimer greater than 1 microgram per ml could help the clinician identify poor prognosis early stage. Prolonged viral shedding provide the rationale for a strategy of isolation infected patient antiviral intervention in the future. COVID-19 classified as mild, moderate, and severe. And pneumonia, acute respiratory failure, acute respiratory distress syndrome, acute exacerbation, chronic obstructive pulmonary disease, viral sepsis, organ dysfunction, ranging encephalopathy to acute kidney injury and shock, leukopenia, intubation for mechanical ventilation, cardiac injury, non-ST elevation, MI. Surviving sepsis campaign our one bundle of care: measure the lactate and obtain blood culture before administering the antibiotic, broad spectrum antibiotic, and benign. Begin to rapid administration 30 ml per kg crystalloid fluid for hypertension and apply vasopressor if hypertensive during after fluid association to maintain the blood pressure, mean arterial pressure more than 65. And sepsis happen when infection already triggered a chain of reaction. So without timely treatment, sepsis rapidly tissue damage, organ failure, and death. Wound infection, also called sepsis. Sepsis, severe septic shock, if not controlled, not reversible, ultimate death. Septicemia, the blood on the blood, there are bacteria flow. In neonate, sepsis refer to the infection when newborn, especially bacterial blood stream, and sepsis lead to organ damage and death. All congenital infection, major risk factor of maternal infection, early sepsis within 7 days, and late sepsis 8 to 28 days. Septicemia, hematogenous shedding, focal infection as meningitis, osteomyelitis, Streptococcus beta, Group B Streptococcus, Staphylococcus aureus, Gonococcus, Candida albicans, gram-negative infection, urinary tract infection. Physical examination, blood culture, blood examination, creatinine, bilirubin, urine output, and coagulation profile, chest X-ray, ultrasound, CT scan, echocardiography, and CSF examination. Supportive treatment in the ICU, and if 10% dextrose to maintain the normal glycemia, maintain fluid electrolyte balance. If capillary fill time more than 3 seconds, 10 ml per kg normal saline bolus. Prevention by vaccine, hand washing, and supportive treatment, specific antimicrobial, immunoglobulin, IV, IgG. ICU treatment and stop the sepsis, we have to make rapid action and prevention, transmission. Thank you.